Today we'll guide you step by step on how to use your blood glucose monitor BG-710.
Step 1. Insert the batteries. Insert the batteries, making sure they're in the right way. Step 2. Set up the date and time. The device will turn on automatically, allowing you to set the date and time. Use the left buttons to adjust the year, top button to increase, bottom to decrease. Then press the center button to confirm. Do the same for the time. Step 3. Set up an alarm. You'll now have the option to set the alarm to remind you to test. You can set up to 6 alarms. Use the left buttons to toggle on, off, and press the center button to confirm. Your blood glucose meter will automatically turn off and it is now ready to be used. Step 4. Prepare the lancing device. You will have received a lancing device and a packet of lancets. The lancing device has 9 different levels, which signify the depth and how far the needle will go into your skin. Set your preferred depth level by twisting the top of the lancet. 9 is the deepest level. Open the lancing device with one twist and unscrewing the top half of it. Next, twist the circle top of your lancet in order to reveal the needle. Keep the top so that you can recover the needle once you've finished. Put the lancet into the lancing device with the needle facing up. Next, put the top of the lancing device back on and screw it shut. To load the lancet, pull back the bottom of the lancing device until you hear a click. You'll know that the lancing device is ready when you see a red dot in this window.
This will be the button you click to fire the lancing device.
Step 5. Wash your hands. Wash hands to sterilise and prevent cross-contamination and to warm the hands.
Dry hands thoroughly to prevent moisture from damaging the test strips.
Step 6. Turn on your blood glucose monitor. Make sure your blood glucose monitor is off. Inserting the test strip into the strip bolt, which can be found at the top of the blood glucose monitor. This will make the blood glucose monitor automatically turn on. Ensure the contact bars are facing towards you. Step 7. Set the meal marker function. Press and release the Kinetik Wellbeing heart button to select the meal marker function. Its default setting is no marker. Wait for the flashing blood symbol.
This will indicate that it is ready to be used.
Step 8. Take a blood sample. Choose a finger to prick, avoiding the thumb or index finger and ensuring that you don't prick the middle of the finger or too close to your nail. Make sure you are using a different finger and area each time you take a blood sample. Place the lancing device to your finger and press the red dot on the middle of the lancing device to fire it. Discard of the first drop and use the second blood drop. Hold the device upside down and place the test strip onto the blood sample. You'll see the white line on the test strip fill up with blood. Ensure the white line is completely filled up with blood. A countdown will start to show that it's processing your reading. It will then make a beep noise and show your reading. On the bottom of the screen is 3 coloured lines, red, green and yellow. An arrow will appear pointing to one of these colours, showing if your reading indicates that your blood glucose is red, which is low, green, which is normal, or yellow, which is high. Step 9. Eject the test strip. Remove your test strip by pressing the eject button located on the right side of the device.
This will automatically turn off the device.
Remember to remove the lancet out of the lancing device, discarding it in a sharps box.